Well, climate change continues to be a major topic of conversation across the state of Michigan and around the world, especially here in the Great Lakes state recently, as we've had a number of 100-year storms, 1,000-year storms as they've been called by some officials, and those have caused a number of different issues and addressed a number of different and brought a number of different other issues such as infrastructure to the forefront. We're pleased to be joined by a graduate student from the University of Michigan's School of Environment and Sustainability, Julie Carter, with us now on the MegaCast. Julie, thanks for being with us.
Thank you for having me.
Appreciate having you on. So you've been doing some research at the University of Michigan along with Dr. Patricia Komen, who co-authored a recent study in the Journal of Environmental Studies and Sciences entitled Assessing Perceptions and Priorities for Health Impacts of Climate. And one of the interesting things that was found in that study was that more than 3/4, or 77% as it was marked, of local health departments surveyed across Michigan agree that climate change would impact their jurisdiction in the next 20 years, but only 35% of those officials said climate change was a priority in their department. Why right now, especially as we're in the times that we're in, what we've experienced over the summer, particularly in terms of inclement weather, should it be jarring to people to see those numbers where these health departments, 77% as it's listed of those surveyed, recognize climate change as an issue, but that less than half of them, by a significant margin, less than half of these departments that were surveyed then say that this is something that's a priority for them going forward?
Yeah, definitely. So that disconnect was one of the really interesting things that we found in the survey, as you mentioned. And I think, that's something that people should be aware of because it is one space where climate is going to have a really tangible impact currently and especially into the future in the public health arena through a variety of ways in Michigan, including some of the infrastructure pieces that you alluded to, water quality, air quality, things like expanded territories and ranges for vectors of disease. And so all of those things obviously have implications on people's health and maybe increasing the number of things, or at least exacerbating the number of things that public health departments have to deal with on the front lines. And so being prepared for any increases in those sorts of things would be right in their purview. And if that's not happening, that's something to make note of.
Especially in the context of what we have undergone since March of 2020 during the COVID-19 pandemic. What are some of those adverse effects of not addressing climate change from a health department perspective going forward, not only during a situation like this pandemic, but in other crises that may arise in the future going forward 20 plus years?
Certainly. So one thing that we thought about in, working on the paper, which we were doing in 2020 during kind of the earlier height of the pandemic, are kind of the way that those two things are going to intertwine, the pandemic and eventually future pandemics and some of the impacts of climate change. So a lot of our public health strategies for dealing with heat waves or when a dam fails, as it did last spring, is to move people together for shelter, for cooling. And if you can't have people safely congregating together in a cooling shelter or other sort of shelter as a respite from any of these sorts of events because of COVID, it leaves a question, what do you do when these things kind of butt heads in the public health arena?
We're joined by Julie Carter. She's a U of M graduate student in the Department of Environment and Sustainability with us today on the MegaCast, who did some recent studies alongside Dr. Patricia Komen, really interesting studies surveying local health departments across the state of Michigan and their approach to climate change as a major issue and their priorities in regards to climate change in the next 20 years, and found some pretty jarring results and are trying to address that as climate change does affect public health significantly. And going forward, Julie, I want to also ask you about how these local health departments, according to your expertise and to Dr. Komen's expertise, what are some ways that these health departments can address climate change? Because on one hand, it does affect public health in a direct way, but public health officials aren't necessarily those that one would conventionally think are on the front lines of addressing an issue like climate change.
Right, and that's definitely some best practice to incorporate some of those climate impacts may be. One thing, and there is literature from other states suggesting this, is that there's a lot of opportunity potentially to, instead of trying to create, brand new programs within public health that address climate change and building that up from the ground level, is to kind of incorporate or fold in the climate aspect and the way that climate might impact public health into already existing things. And so as one example of that potential opportunity, a lot of public health departments already have programs in place to monitor ticks, say, that could spread Lyme disease. And climate change is projected to expand the range of various disease vectors, including ticks. And so folding in the climate piece and the expanding range piece based on climate change into the existing monitoring program is one way that you don't have to necessarily start from scratch, but just trying to fold in the impact of climate into existing relevant programs.
We're joined by Julie Carter. She is a U of M graduate student and researcher in environment and sustainability at the University of Michigan with us on the MegaCast today. And Julie, if these health departments aren't properly prioritizing and then on top of that properly addressing these climate change issues like tracking the impact of ticks that may be spreading Lyme disease, how badly, depending on the size of those departments, could that affect local communities of varying different sizes, demographics, and socioeconomic backgrounds in the future?
Sure. So if local health departments, for a myriad of reasons, aren't doing that sort of preparation and that sort of work, it could definitely be an issue now and in the future. There's a lot of research that shows that local public health officials and departments are some of the most trusted actors in the community. And so they're often like one of the first sources of information that people will turn to. And so that's a crucial piece and link in the chain of information. And if they're, for whatever reason, not able or not doing this sort of preparation, you're going to be missing that link in the chain.
And something that we've seen be very evident during the pandemic, not only our local health departments, our state health departments, but really at a federal level as well, there seemed to have been a almost complete lack of preparation for a situation like a pandemic, even though we've had incidents in recent years such as H1N1 or the swine flu or Zika virus that weren't pandemic levels but had reached epidemic levels in some cases, and still we were left unprepared by these health departments. It's a similar but also a different issue on some levels, climate change, but that evidence is there to show just what happens when we aren't prepared on a public health level to address these major issues.
Yeah, definitely. So, as I stated before, public health departments, especially at the local level, are really, some of the first people in line to contend with any of these things, whether they be diseases that crop up or environmental health hazards that develop. And so definitely them being prepared and them being ready to be a source of information and a source of care on the ground is very important for any of those health challenges.
Julie Carter joins us on the MegaCast. She is a grad student in the School of Environment and Sustainability at the University of Michigan with us today. And Julie, where should these health departments start in addressing climate change on a larger scale, on a greater level? Because as it's marked in this study, 77% of the health departments that you surveyed and that Dr. Coleman's survey agree that climate change will impact their jurisdiction in the next 20 years, but only 35% of those surveyed said that climate change was a priority. And we also talked about the variations in size and the variations in funding and support from the community and at the county level for a lot of these health departments. So in a general sense, regardless of the size, regardless of the financial backing, where is a good spot for these health departments to start addressing climate change now so they're not chasing it down the road?
Yeah, so the good news with all of this is that there are resources both from the federal government as well as from the state government available for some of these local departments to start thinking about climate change and associated programs. So at the federal level, the CDC has a informational resource as well as a financial resource, a grant program through their BRACE, which is building resiliency against climate effects, is the program. And so they both have informational resources, documents, literature, as well as grant funding opportunities for states and cities to do some of this climate preparation work. And the state of Michigan is actually a grant recipient from that CDC BRACE framework. And so the Michigan Department of Health and Human Services, MDHHS, at the state level, obviously, is also a great resource. They have a climate and health program that's doing a lot of this work and also making those outreach efforts to localities to try to bring them on board in a more meaningful way with the impacts of climate. And so both federally and at the state level, there are resources out there.
We're joined by Julie Carter. She was a graduate student at the University of Michigan in the School of Environment and Sustainability with us on the MegaCast. Julie, how can we find more information on this study and on the work that you've done with Dr. Patricia Komen at the University of Michigan?
Sure. So the study is public access, so it's available to everyone. It shouldn't be behind a paywall or anything at the Journal of Environmental Studies and Sciences. People can also feel free to email me at my U of M email address that I can give you if they have specific questions that aren't addressed in the study.
Julie, anything else that would be important for our audience to know on this issue of addressing climate change from a public health perspective at the public health department level going forward, or anything else interesting that we maybe didn't touch on today that was found in your study with Dr. Komen?
And I think I would just emphasize that a lot of people, myself included, may not always be thinking about the local health department or even know where it is, know what it is in their area, but that when it actually comes down to it, it's a really important resource to be able to reach out to, as we've seen really highlighted during this COVID-19 pandemic. And so being aware of local issues and funding issues and all of those sorts of things around public health locally may not always be on the radar, but isn't that we should be looking out for in our own communities.
Well, Julie, we appreciate your time, appreciate your insight. Thank you for enlightening us on this connection between public health and climate change and why it's so important for those to be addressed together going forward.
Yeah, thank you for having me. I appreciate it.